Hey everyone, this is the part 3 of Podiatry billing and coding video. If you haven't seen the part 1 and part 2 video, the link is in the description box. Please go and check it out. If you are new to this channel, please click the subscribe button below this video so you get notification every time whenever I post new content, helping you to stay updated and improve your skills in this field. Join our community and let's grow together. Let's see how to code for biopsy of nail unit. Biopsy of nail unit is a common procedure done by a podiatrist. The right procedure code for biopsy of nail unit is 11755. The primary diagnosis should be L60.8, other nail disorders. Secondary diagnosis is not required for this code, but T modifier is required for this code to indicate on which toe the biopsy of nail unit was performed. Now let's see how to code for excision of benign lesion by the podiatrist in the feet. There are 6 codes used for excision of benign lesion in the feet: 11420, 21, 22, 23, 24, and 26. Based on the excised diameter, you have to choose the right procedure code. The primary diagnosis should be L98.9, disorder of the skin and subcutaneous tissue, unspecified. Secondary diagnosis is not required for this code. Modifier LT or RT is required to indicate on which side of the feet the excision of benign lesion was performed. Let's see how to code for percutaneous tenotomy. Percutaneous tenotomy is a common procedure performed by a podiatrist. Before moving to coding section, we should know what is percutaneous tenotomy. A podiatrist made a small incision in the toe to release a tendon. It's called percutaneous tenotomy. There are 2 codes used for percutaneous tenotomy. When a provider performs percutaneous tenotomy of toe in single tendon, we have to use 28010. If it is multiple tendon, we have to use 28011. These are all the primary diagnoses that you should be using for percutaneous tenotomy: hallux valgus, hallux rigidus, hallux varus, other hammer toe or toes, other deformities of toe or toes, other specified congenital deformities of feet. Secondary diagnosis is not required for this code, but if the patient has pain in the feet or toe, you can use it as a secondary diagnosis. T modifier is required on this code to mention on which toe the tendon was released. If it is done for multiple tendons, you have to mention all the T modifiers on which the percutaneous tenotomy was done. Hey, are you a podiatrist and you need help with billing and coding? You can contact me. I'm Arun Kumar, a certified professional coder and biller. I can help you to grow your business. Now let's see what is arthrocentesis and how to code for arthrocentesis procedures. When a provider inserts a needle into the joint to remove the fluid or to inject a drug is called arthrocentesis procedure. When an arthrocentesis was done in the small joint, for example toes, without the ultrasound guidance, then you have to use code 20600. When an arthrocentesis was done in the intermediate joint, for example ankle, without ultrasound guidance, then you have to use code 20605. The primary diagnosis for arthrocentesis should be either effusion, pain, or stiffness of joint. Secondary diagnosis is not required for arthrocentesis procedures. T modifier is required for code 20600 to indicate on which toe the arthrocentesis procedure was performed. LT or RT modifier is required for code 20605 to indicate whether the arthrocentesis was done in right or left side of the leg. If it is done in both legs, then you can add 50 modifier to indicate it is a bilateral procedure. Now let's see how to code for plantar fascia injection. When a patient develops a non-cancerous growth on the plantar fascia region, the provider performs this procedure. Code 20550 is for single tendon sheath or ligament. The primary diagnosis should be M72.2, plantar fascia fibromatosis. Secondary diagnosis is not required, but if there has pain symptom, you can code pain as a secondary diagnosis. Modifier LT or RT is required for this procedure. If the provider performs this injection in both legs, then you have to add modifier 50 to indicate that it's a bilateral procedure. Now let's see how to code for Morton's Neuroma injection. When a patient having inflammation on a nerve in the feet and having pain, the provider performs this procedure. Code 64455, injection, anesthetic agent and/or steroid in the plantar common digital nerves. The primary diagnosis should be G57.61, 62 or 63. Secondary diagnosis is not required for this procedure, but if the patient is having pain, then you can code pain as a secondary diagnosis. Modifier LT or RT is required on this procedure. If the procedure was done at both legs, then you have to use modifier 50 to indicate that it's a bilateral procedure. We have gone through a lot of procedures performed by a podiatrist and how to code it in part 1, 2 and 3. Now it's time to look for modifiers. When a provider performs separately identifiable E&M as well as the procedure, then check the CC edits and use modifier 25 to the E&M service. You cannot bill both the E&M service and the procedure for the same diagnosis. It has to be separately identifiable E&M, and the diagnosis should be different for E&M as well as the procedure. When you check CC edits for two different procedures done by a podiatrist and you see an edit, then you have to use either XS or XU modifier. When each procedure is done at different site, then you have to use modifier XS. When both procedures are non-overlapping, then you have to use modifier XU. These are the most common procedures done by a podiatrist. Now we know how to code these procedures. Hope you like this video. If you have any suggestion, please mention in the comment section. See you on the next video.